So let's talk a little bit about all the amazing things that you've done. For starters, you've founded 3 companies. All 3 of those companies have been spectacularly successful. You are famously the most highly paid CEO, female CEO in the country, but you were not born a female. And you've written a book recently, a terrific book, by the way, called Virtually Human. And a lot of what you talk about in that book is that we are close to the ability to upload our brains and personalities into computers. So let's go through this. Let's go through all this chronologically. Let's talk a little bit about the beginning. You went to a NASA tracking center in the 1970s, and you had a revelation.
Yeah, that's right. I had always loved space technology, so I grew up watching, as a little kid, astronauts landing on the moon. And so I was tremendously motivated by that and hoped that I too would be able to have a chance to go to space. Then came the space shuttle and the dream that we would be building, large space stations with the space shuttle. One of the most transformative movies in my life, I'm a person who has been influenced very much by Hollywood film, was 2001: A Space Odyssey. And it was just like so awesome seeing this big, rotating ring in space. And there was like a Hilton, Hilton on the moon and stuff like that. And it just all seemed so tangible and real. And then kind of, in the Nixon administration and Watergate and all that, things kind of seemed to go downhill in the space program. And I did get depressed about that, and I went off traveling around the world trying to kind of find some peace of mind. Ended up at this remote island chain, the Seychelles Islands in the middle of the Indian Ocean, where there seemed to be no technology. But a local person who I met there invited me to see a NASA tracking station, which of course I would be drawn to like a bee to a flower. And there was this big NASA tracking station. And the NASA engineer there explained to me that they were receiving signals from the Pioneer spacecraft, which were out at that time by the orbit of Jupiter. And the signals were so weak and tiny, it would be like seeing a flashlight from the other side of the US. So they needed this humongous collecting satellite dish. And when I got into a conversation with him, he finally admitted that if the transmitter in the space probe was as big as this giant house-sized antenna that was collecting the information, the signal from Pioneer, then the receiver could be as small as the flashlight, that was kind of shining the light. And so in my mind, I just flipped it around and I said, okay, well, I'm going to build like a big house-size satellite transmitting antenna in orbit and connect the whole world together with tiny flashlight-size antennas. So that was Sirius XM, and it gave me the inspiration for it. One of the treasures I have is a signed paper by Arthur C. Clarke in Wireless World around 1945, 46, where he predicted geostationary satellite communications. And I'm really happy that he lived to see this nervous system of humanity actually fall into place during his lifetime.
Did you actually talk to him?
I never had a chance to meet him face to face, but a good friend of mine, Peter Diamandis, head of the X Prize, he's dealt with him extensively. So I'm kind of like one through Peter to him.
So your revelation was that the whole world really could be connected through satellites.
Exactly, and that is exactly what we're seeing today with the tremendous presentations that we had earlier this morning about Professor Negroponte and the one computer for everybody. And just, I am convinced that we haven't seen anything yet in terms of space junk. I mean, one, people don't realize how much space there is in space. I mean, it's humongous. But this planet in another 100 years is going to have basically a complete shell of satellite transmitters of all different sorts, nanosats, microsats, you name it, all connecting all of us together in one massive nervous system.
And is that all good? That sounds like we're heading towards Skynet there.
I think it's all good because, the problem with Skynet, was not the Skynet technology, it was the evil purposes to which it was used. And I think we all owe a debt of gratitude in this generation, frankly, to Larry Page and Sergey Brin, who had the gumption when they took Google public to put right in their IPO prospectus that we will not be evil. And you know, a lot of people said like, wow, that's not business speak, but you know, they didn't care. They were being honest. And there's, I know, different points of view, whether you know Google has been true to that or not true to that, but that at least is their value. And you know, satellite technology, whether it's like fire or metallurgy, it could be used for horrible purposes or it could be used for great purposes. And satellite communications is a great resource for humanity. We've been able to predict weather, tsunami, hurricanes, get food to people in Africa, help to people in Sumatra from a tsunami. But if we use it for good purposes or bad, that's up to us humans to decide.
So you launched Sirius Radio. That is a huge success. You're a space lawyer at this point, right? And then suddenly you move over into the world of biotechnology, which is not an ordinary career path. How did that happen?
So it wasn't my choice. Frankly speaking, I would be happiest probably being some employee at SpaceX working on getting people to Mars. But we have 4 children, and my youngest daughter was diagnosed out of the blue with a generally fatal condition called pulmonary arterial hypertension. She was diagnosed right here at Washington National Medical Center on Michigan Avenue. The doctor said there's no medicines approved for it. She's got, you know, maybe like 3 years to live. And I went right ahead and I did research on my own, and I found out what he was saying was true. There were no medicines for it. Everybody did die. There were only 30 doctors in the whole country specializing in the condition because all the patients were dying, and there were only 3,000 left in the whole country. So I just felt that, like, you know, I had no choice. I felt like my only purpose in life now was not to help move to the stars with satellites and stuff like that, but instead it was to save Genesis, that's my daughter's name. And so I just stopped everything I was doing. I began reading, you know, biology textbooks for high school, anatomy textbooks from college, things like New England Journal of Medicine, Journal of American Cardiology, all these peer-reviewed journals. At first I didn't understand, you know, 95% of what I was reading, but I would just go back to the biology textbook, back to the peer-reviewed article, back and back and back and back. Finally, I found like a little glimmer of hope that there was this molecule that might be able to help her. And I knew that my only purpose in life, I actually said to myself, if all I do before I die is to save Genesis, then, you know, that's what I'll do. And my advice today to entrepreneurs, this sounds harsh, but you've got to want to succeed more than you want to live. That's the type of passion you need to overcome all of the naysayers, all of the obstacles that you'll run into.
So continue the story. You found this molecule. How did you pursue that?
So it was a tremendous, you know, needle in a haystack that was about as useful as just a needle in a haystack. I mean, what good is a needle in a haystack? So I found this molecule. It was owned by a big pharmaceutical company. They did not want to develop it themselves, even though I had some financial resources from taking SiriusXM public. They said, you know, we're not here to work for your money. You know, we're here to treat conditions that will generate billions of dollars in revenue. 3,000 patients, that's not what a big pharmaceutical company does. They told me they wouldn't give it to me because I might discover some side effect of that molecule that might affect some other molecule that they have in development, and they didn't want to like spoil anything else. They also said it would not be ethical for them to give a molecule to somebody that had no experience in developing medicines. So that was a stopper there. I finally overcame all of those objections by building a team of scientists, and I came into them this next time with, like, you know, great scientists to the right, great scientists to the left. Then I found out when I finally got the rights to that molecule, it's called treprostinil. At the beginning, I couldn't even pronounce these medical names. I mean, I can say like warp drive and stuff like that, but treprostinil is like, oh, I can't do it. So I learned to say all these words. Then what happened is that molecule had no way to be synthesized into a medicine. You know, a molecule is like circles and sticks and circles connecting them. So you have to take that combination of hydrogen atoms and oxygen atoms and whatnot and actually manufacture it into a medicine that's either in a pill form or an injection form. And it turned out that to make that molecule, it took a 23-step chemical synthesis with 2 explosive stages that had to be avoided during that synthesis. And it was kind of like, you know, I went back to them and I said, hey, do you realize how hard this is? We said, we told you that, you know, we shouldn't give this to you. So I then spent a year going throughout the whole US to chemistry departments to try to find a chemist who could take this molecules on paper and create an actual practical way to synthesize it into a medicine. And I finally found one guy, Dr. Robert Moriarty, the chairman of chemistry department at University of Illinois. He said if I gave him $100,000, that he might maybe have an idea on how to do it. He said he visualized it in his head and he could try to maybe do it. So I did that. He was my last best hope. And I gave him the 100K. And he produced a half a gram of that medicine, which is so little, it's kind of useless, really. But he said, I did it, and he showed it to me, and it was so small, and by that time, my expert team told me, Martin, you can't give that, it's too small to give to even animal studies. You're gonna need, you know, at least dozens of grams for animal studies, hundreds of grams for clinical studies with patients, and ultimately kilograms to have something that could help everybody in the country. So I just, you know, pedaled to the metal and plowed forward and didn't get discouraged and built up the process step by step to the point that today we make about 50 kilograms of that molecule a year right up the road here in Silver Spring, Maryland. And by the way, people told me, Martin, you can't make medicines in Silver Spring, Maryland. You have to do that out at 270 in, like, you know, Germantown or someplace. Yeah. But you can imagine I'm not a person that likes when people say to me, like, you can't do this. So we make it right in Silver Spring, Maryland, part of the community and everything. Everybody loves it there.
Well, the real estate sounds like one of the smaller obstacles. So
yeah, I agree. It was one of the smaller ones. But when the building guy said, well, it's too small a footprint, I said, really? You know, we could do this. So, and today those medicines are taken by thousands and thousands of patients. That 3,000 patients that there were when Genesis got diagnosed is now, between the US and Europe, there's over 100,000 patients living with pulmonary hypertension. And it sounds bad, like I made 100,000 people with pulmonary hypertension, but it's good because all those people wouldn't even be alive. I mean, they would have all died. And, and now there's tens of thousands of people living a healthy, happy life with pulmonary hypertension. Best of all, and you know, I just owe enormous gratitude for this whole story to her because she was my inspiration, is our own daughter Genesis, is now 30 years old, works in United Therapeutics, and is a happy, healthy young lady.
Isn't that an amazing story? Truly unbelievable story. So you essentially founded this company and saved your daughter's life.
Yes, and many other people.
And many other people. And the medicine itself is a very successful drug. Obviously, you've saved tens of thousands of lives doing this. Does the original drug company, were they surprised by this? Have they benefited from this?
They were very surprised. Now, as probably all of you guys know, pharmaceutical companies are always like buying each other. So what was Burroughs Wellcome when it began became Glaxo Wellcome, became SmithSonian Glaxo. But the head of the research and development department, who was my main contact, Dr. Robert Bell, he ultimately retired and became an advisor to a venture capital fund in the North Carolina Research Triangle Park area. And when our company turned 15, by which time, by the way, this little molecule that nobody cared about was generating $1 billion a year in revenues.
Wait, say that again.
It's $1 billion a year in revenues from these thousands and thousands of people taking the medicine. And,
Wow.
and by the way, we've never turned away one patient who's unable to pay. From the founding of the company, I said, if anybody can't pay for the medicine, or even if they're close to their lifetime cap, we will give that medicine to them for free. And we've done that forever. And nobody's ever gone without this medicine. And it hasn't stopped us from being a successful pharmaceutical company. I think actually doing the right thing always helps you do the best thing for yourself. But in any event, Dr. Bell, I wanted to invite him. We had a 15th birthday. And you know, like in the Latin culture, when a woman turns 15, it's called a quinceañera. Mm-hmm. And they have a big party. And somebody comes from each year of your 15 years of life, and you says something like, oh, when she was 5, she did such and such. So I decided to bring one person from each year of our life. And of course, getting the medicine, Genesis was the first one and whatnot. But very soon, early number 2, 3, 4 was Dr. Bell, because he finally allowed me to get this medicine out of Glaxo. And he came and he told everybody there that the lawyers, when we finally got the molecule out of Glaxo, they wrote a clause in there that we would pay 10% of any money that we made back to Glaxo. So they did nothing. They just gave us the rights to this molecule, which by their own admission, there was no practical way to make. They gave us something that they were certain was useless. We have since paid them 10% of our revenue. So like $1 billion in revenue, we pay them $100 million year after year after year. And they have admitted to me, Dr. Bell told everybody that this was the absolute best investment that Glaxo Wellcome had ever done.
That's amazing.
So it's another lesson, though. When you do right, you do good.
Now, this is just such an extraordinary story. You, of course, had some sort of degree in biology or in medicine?
No, I actually didn't. When I started, I was just a space nut, you know, and so I didn't. But when Glaxo refused to license this drug to me, saying it would be unethical to give a medicine to a person or even a group that had no experience in developing medicines, I said, okay, first I'll find some great scientists to join me. That wasn't that hard. You kind of pay their salaries and people will come. I said, but to manage people, you have to know what they're doing. The reason I think I have been successful in the satellite communications companies is I knew what the engineers were doing. I could talk the talk. I understand telecommunications and satellite communications. So I went back to school after starting United Therapeutics to get a degree that would allow me to design the smallest possible clinical trial that would give us the highest probability of getting an FDA approval. And therefore, to get the FDA approval, the clinical trial has to be in compliance with all ethical requirements. So that field turns out to be the field of medical ethics. And it's tremendously important. I have to tell you that you know, hundreds of thousands of lives, maybe even millions of lives, hang in the balance between well-designed clinical trials and poorly designed clinical trials. Because a poorly designed clinical trial will keep a medicine away from people who need it for maybe forever. And a well-designed clinical trial will get medicines to the people that need it much more quickly. So I ended up with a PhD in medical ethics, but I got that while I was running the early years of United Therapeutics.
Unbelievable. I can talk to you all day. We don't have a lot more time. I want to get to the idea of uploading our brains, and I'm sure everybody else wants to hear about this too. We've all seen the movie Her, the terrific Spike Jonze movie. How close are we to something like that, an artificial intelligence that we can relate to, even have a relationship with?
I think there's, you know, pretty much of a growing consensus that we are within, you know, some number of handful of decades from there, whether it's, you know, 2 or 4 decades. And, you know, I wouldn't ask anybody to take my word for it in particular. There's, first of all, one of the greatest geniuses of our times, Ray Kurzweil, invented the scanner, the voice synthesizer, talking book for the blind. He's now director of engineering at Google. I'm not giving advertisement for Google, but I do think that, like, when I talk to Google compared to when I talk to Siri, Google understands me like a lot better. And I think that's Ray Kurzweil's work over there that he's doing. Alexa understands me pretty good if you're on the Amazon side. So he's written his books where he pins the time as like basically 2030, that's just like 15 years away. I mean, I think how quick 15 years is. I'm like mourning the loss of Prince, this week, and I'm thinking it seemed like just yesterday it was 1999 and I was dancing in the street to 1999, but that was 16 years ago, okay? So Kurzweil is 2030. You have people like Stephen Hawking and Elon Musk saying that this is such a big issue and such a big concern about, mind uploading and AI, that we need to have, a big think tank about it. We need to develop some laws and regulations. Well, if it was just science fiction, why would you even worry about it? Right. So if you have the greatest thinkers in the world, the Aspen Institute is convening a huge conference of the world's greatest thinkers on this. I would say there's a growing consensus that in a handful of decades, her will be a reality.
And you've been working on this already. I know we've got a picture perhaps of a robot that you've constructed. Tell us just a little bit quickly, because we're on the red light, about Bina 48.
Yeah, so Bina 48 is a robot head modeled after my soulmate, life partner, Bina Aspen. It looks pretty much just like her. The skin is made of a material invented by this guy David Hansen called flubber. It feels exactly like flesh, but it's made basically of a rubbery material. There's lots of what are called like MEMS, microelectronical mechanical systems inside the flubber that moves the facial expressions. There's been lots of video taken of Bina, so the face moves exactly the way the real Bina's face moves. Frankly, I think all of that is a little bit of like the magic show on the side. The real interesting part is what we call the mindware and the mind file. That robot has thousands of hours of interviews and videos that have been taken of Bina, answers to questionnaires of any psychologists in the group, like the Big Five questionnaire, and there's all types of there's dozens of psychological questionnaires. All those questions have been integrated into the software. So Bina rarely answers the same question the same way twice. It's not like a chatbot or something. You ask her a question, it comes up with idiosyncratic answers. In fact, people are developing a book, The Wit and Wisdom of Bina 48, because she says things that are maybe not totally, it's not like they're just unanticipated, and frankly, they're insightful. Right. And so Bina 48 is there interacting with people, and I think making people's lives better, and even Bina herself enjoys interacting with her.
That's great. Ladies and gentlemen, the future is right here.